Good evening, everyone. My name is Sheena, also known as Sammy P Associates. So, welcome to my channel. Bye bye. Anyways, recently I posted something on my Instagram in regards to any topics you want to talk about, and somebody asked me about like what can you get most in your health insurance. I mean, honestly, I might not be the most expert to it, but as you all know, everybody does their research, everybody asks questions and everything, so I'm gonna give my little input out of it. There are a lot of health insurance out there. Basically, half of us can be paying with co-payments, or actually, with the low income, it's the Medicaid and some kind of assistance from it. I used to have that before I became a regular staff in the hospital. So it was actually a Medicaid and Fidel's Care, which is highly recommended for the low income people. Um, it actually paid for my treatments for endometrial cancer and asthma, heavy asthma. Um, Most of the medications cost, like especially with cancer patients, it's like if it's out of pocket, it's more than 1,000 and above. And usually, like without insurance, a lot of people with low income, they ended up having debts. I almost did. If it wasn't for Medicaid and Fidel's Care, I wouldn't been alive right now. Anyways, so let's talk about the regular the regular health insurance. There are like a few like health insurance that are out there. And what I posted in Instagram is I'm only gonna be talking about a few of them, since I cannot have a longer topic of it out of this. So some samples that we have was a group health insurance, which is also known as GHI. GHI has the freedom to choose any provider, so basically you can actually look for any doctors you want to meet. And I think, as I remember, you don't actually need to get a referral. Unlike HIP, also known as Health Insurance Plan, I think it's part of Emblem Health. Well, Emblem Health and GHS is basically the same. And I shouldn't be saying I think it is part of GHI, of HIP, Emblem Health. So for Emblem Health is the largest nonprofit health plans, and you I'm on that plan right now, and they actually, you gotta get referrals. That's the hardest part. So the other health insurance that I actually research about is the Blue Cross Blue Shield. Most states offer it, which is perfectly good, but this is a catch. It's a little expensive. According to data, for a single coverage in 2018, it's actually, you gotta pay 440 per month, and that's just 2018. I don't know about 2019 now. The fourth one that I'm talking about is Aetna. It covers dental, vision, and as what I've heard from other patients who had them, excellent reputation. Also, um, let's go back to HIP and GHI. I never had GHI, so I shouldn't even say anything about it. But I think with HIP, especially with city hospitals, they only offer a certain kind of like certain kind of. It's not like, it doesn't cover as much as from any critical conditions, but you still gotta pay co-payment. And I think like Aetna and Blue Cross Blue Shield, they do. So the last one that I'm gonna talk about is MetroPlus, which is only covers New York. Um, the best part about the health insurance is if you're actually trying to go for your weight loss, especially gym, like what I known is they actually been um I forgot the word. They're actually giving back whatever you spend in the gym, as long as with a weight loss. It's like a weight loss program. So let's go back to the topics. Only actually find out that there are 7 tips what you can actually get most out of your health insurance. What the first one is actually you need to choose the right plan for you. With me, I kind of like I shouldn't have like settled with my health insurance. I should have been like shopping every year, because I don't know if probably GHI is much better for me, or Aetna. The only thing I'm always like I always think, oh, okay, if I stay with HIP, I don't have to do a lot of paperwork and everything, and that's the main problem. But what I heard, you need to start shopping. So starting next year, or the next time that next time that I next time I need to shop again around for the plans for the health insurance. It's better because you don't know, maybe it might be lesser payments, and like you gotta, like, you don't know if it covers dental or opta or orthodontal, or actually optometry. I don't know if it actually covers that. So we need, like, every year you need to shop which one's a better plan for you. The second thing that one of the tips that you can get most of your health insurance is make sure you understand your plan. Um because I'm too stubborn to actually look for plans for me. I just settled on HIP. Like I said before, I need to start shopping for a plan that would be better for me and my family. Actually, it's just me and my husband, so as you can know. Okay, the third one is you need to ask questions. Ask for an advocate. Actually, ask for someone who actually knows, or do your research. That's all you can do. Like, try to understand word by word, and if you actually understand your health insurance plan, it will be easier for you to have the decision what kind of plan is best for you and your family, or best for you. The fourth one is stick with your in-network network providers. Excuse me. Oh my god, that's not coronavirus, okay? Anyway, so I the thing that I did is actually um stick to my providers from, like, doctors, and the providers that I had was in the same hospital they used to work with. And you can actually, like, for like, I don't drive, since this is New York City. Transportation has always been available for everyone. So what I usually do is, what I did was just made my old hospital, my in-network provider, which is convenient for me because you can see a neurology, dentist, psychology, your primary doctor, oncology, and etc. and etc. The fifth one is make the most out of your deductible. So Once you met your deductible, in most plans, you'll pay significantly less out of pocket. Like I was talking about the copayment a while ago. So it just like me, when as employee of the hospital, usually I had to pay a copayment when I go to ER, and which is in a when I meet my primary doctor, it's like $10. But when I get admit, like when I go into emergency room, my copayment stands for 150. I don't know about others. I mean, usually from Fidel's Care, like this is just an example of Fidel's Care and the Medicaid part. I think they don't get to pay the one who actually has a low income, or they, like, if they're having trouble financially. So that's one of the reasons, like they don't really pay or whatever. Okay, so with the sixth one, is you got try to have your prescriptions on the mail instead of getting it on the pharmacy itself. You can actually have it mailed for you. I mean, it's one of the biggest mistakes that I did is due to the fact that I need my medications right away. But some pharmacies will be willing to actually deliver it to you. I think it's less co-payments than you actually go for the pharmacy. I don't know what's the logic of that, but it is what it is. 7 is you need to use your discounts and use your programs and benefits and your perks. Like I said, they all some health insurance, they have this wellness program where usually when you keep using the gym, they give it back to you whatever you actually spend, and they give you like discounts, programs to help your specific medical conditions. So all in all, that answers your questions. I'm gonna try to go to sleep since I gotta go to work tomorrow. And again, this is Sammy P. This will be uploaded tomorrow. I hope you like it. It's crazy, but hey, it's what I can do. Anyways, love up. Peace out. I guess love you guys.